Let me go ahead and gather all my supplies. Hi, can you please let me know your first and last name?
Jason Fraser.
Okay, and date of birth?
July 11th, 1986.
Give me one moment. Hand hygiene. Provide for privacy. My name is Eleisia Gomez. I'm going to be your student nurse. We're going to be doing a head-to-toe assessment today.
Okay.
Can you please let me know if you have any pain?
No, 0.
Okay, perfect. And now I'm going to do a general survey of my patient to start off the head-to-toe exam. The patient is in a proper position. He is well nourished and he has good hygiene. There's no odor. Now I'm going to orientate my patient. Okay, again, can you please restate your name?
Jason Fraser.
Can you please tell me where you are right now?
Naples, Florida.
Okay. Can you tell me what year it is?
2019.
And who is the president?
Trump.
Okay. Throughout the entirety of the exam, I'm going to be testing for skin integrity. This includes the temperature, the color of the skin, as well as if the skin is dry. Okay. Now I'm going to be moving on to the vital signs which we took prior to the exam. Your blood pressure was 121/80. Respiratory rate was 16. Your SATs on normal oxygen, which is in the room, 97%. Your temperature was 98.6, and your pulse was 66. Okay. Moving on from there. Now I'm going to go ahead and I'm going to palpitate your head and your sinuses. If you can please remove your glasses for me. I'm going to be palpitating the head for any abnormalities, deformities, any open skin, any lesions, any bruising. Checking for lice as well. There's no bald spots. Now I'm going to be palpitating the sinuses. Please let me know if there's any areas of discomfort.
Okay.
How's that?
Good. Good.
Any discomfort?
No.
Okay, head is symmetrical and normal cephalic. Sinuses are intact. No pain or discomfort upon palpitation. Now I'm going to be moving on to the cranial nerves. You can go ahead and put your glasses back on again, Mr. Fraser. We're going to be starting off with cranial nerves number 1 and number 2, which is olfactory and optic. If you can please close your eyes. Hold one nostril closed for me. Please let me know what you smell.
Chocolate.
Okay. Now we're going to see the other side. Please let me know what you smell.
Vanilla.
Okay. Go ahead and open your eyes. Now cover your left eye with your hand. Okay. How many fingers am I holding?
3.
Okay. Go ahead and cover the right eye. How many fingers am I holding?
3.
Cranial nerves 1 and 2, which is olfactory and optic, are intact and are within normal limits. Now we'll be testing cranial nerves number 3, 4, and 6. 3 is going to be the oculomotor, 4 is trochlear, and 6 is abducens. Let me grab my pen light. Okay. Now if you could please remove your glasses for me again. You can see how they dilate with light. Okay. Pupils are equal, round, reactive to light and accommodation. Pupil gauge is 3 millimeters using my light pen. If you please put back on your glasses. Without moving your head, I'd like you to follow my pen light. Up, down, to side, and up, coming down, starting at the bottom, coming back up, in the middle, making sure that the subject patient is not cross-eyed. Cranial nerves 3, 4, and 6 are intact. 3 oculomotor, 4 trochlear, and 6 abducens, and they are within normal limits for the patients. Now I'm going to be assessing cranial nerves 5, 7, 8, and 11. 5 is trigeminal. It has 2 sensory and also motor. 7 facial, 8 acoustic, and 11 is spinal accessories. So to start off with 5, you can please close your eyes. Let me know which side you feel this on.
Left.
Okay.
Right. Forehead.
Okay, go ahead and open your eyes for me. Clench your teeth. Let's fill in that teeth. Any discomfort or pain?
No.
Okay. Now we'll be testing cranial nerve number 7. Go ahead and smile for me. Frown. I'm gonna go to your forehead. Puff out your cheeks. And give me a kissy face. Okay. Let's do 8. I'm gonna whisper something into your ear, and I'd like you to repeat it back to me.
Hello. Goodbye.
Okay. Now we'll be doing cranial nerve number 11. Please, with resistance. Perfect. Resist my hand. Resist my hand. Cranial nerves 5, 7, 8, and 11 are intact. 5 is the trigeminal. 7 is facial. 8 is auditory. 11 is spinal accessory. Now we're going to be testing cranial nerves 9, 10, and 12. 9 is glossopharyngeal. 10 is vagus. And 11 is hypoglossal. To do this, again, I'll be using a pen light. Go ahead and open your mouth and say ah for me. Ah. You know that is midline, and it moves when he says ah. Now I would like you to say your name, please.
Jason Fraser.
Okay, and swallow. Swallowing reflex is present. The patient is able to speak without any hoarseness to the voice. Now I will be checking cranial nerve 12. With this, I will also be doing your oral exam. Okay, so your tongue out again. Leave it in midline. There is no dental caries present, no oral lesions. Oral mucosa is pink and moist. Okay, resist it. Resist. Let's try this side. Go ahead and resist. Cranial nerves 9, 10, and 12 are intact and within normal limits for the patient. 9 again is your glossopharyngeal, 10 is vagus, and 12 is hypoglossal. Now we'll be moving on from the cranial nerves, and I'll be checking your neck and lymph nodes. Okay. Trachea again is midline. I'm going to be palpitating your lymph nodes. If you need pain or discomfort, I'd like to know, please.
Okay.
Okay. Anything?
No.
Okay. Checking below the jaw. Moving down the neck. And now above the clavicular line. Anything?
Nope.
Perfect. And now I'm going to be checking your carotids. When I do palpate your carotids, I would like you to hold your breath. I'm going to go ahead and palpate it. We're going to do it one at a time. Just for the patient's safety, I'll be listening with the bell. Palpating it. And now we'll be listening. Okay, now the other side. Palpating it. And listening. Okay, there's no signs of bruise and no JVD within normal limits. And the carotid pulses are 3+. Now I'm going to go ahead and I'm going to start with the upper extremities. Going to be looking at them. Normal color for patient's ethnicity, warm and dry. Okay, I want you to go ahead and flex your arms against resistance. Perfect. Now go ahead and put your arms out. Okay, press against me. Perfect. Now I want you to turn your hands back over. I want you to hyperextend your wrist, extend your wrist, flex them. Perfect. Now what I want you to do is grab my fingers and squeeze, please. Perfect. Now we're going to do range of motion. Pick both arms up. Okay, so we're abducting them. Now we want to adduct them back to the body. Now what I would like to do is I'm just going to take a radial pulse. Okay, other one. Pulse is 66, 3+ bilaterally. Skin trigger again is good. Range of motion is 4 out of 4. And now we're going to go ahead and we're going to move on to the chest and chest trigger. I'm going to pull the skin up here to check for dehydration. No tinting, the patient is well hydrated. The chest, there's no evidence, there's no bruising, no gross abnormalities. I'm going to go ahead and listen to the heart sounds. There's 5 that I'll be listening to on the chest. Starting at the second intercostal on the right side with the diaphragm, I'm going to listen to the aorta. Moving over to the second left intercostal, I'll be listening to the pulmonic. Third intercostal, Erb's point. Fourth, tricuspid. Fifth, the mitral valve. While at the mitral valve, I'll count for 1 full minute the apical pulse, which is 66, which matches the radial pulse. I would then turn around with the bell. I would listen to all 5 points again, making sure I listen to S1 and S2 and that they're present. Our heart sounds were normal. Now I'm going to go ahead and I'm going to auscultate the lungs, 12 places, avoiding the sternum. So if you don't mind, sitting up straight for me. Counting out loud. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, and 12. If you can please turn around for me so I can listen to the posterior portion. Counting off again for 16. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, and I avoided the scapula. Breath sounds are present in all lung fills. No wheezing, no bronchi, no rales. Now we're going to be moving on to the abdominal exam. If you can please lay down for me on the couch. To assess the abdominal, I'm just going to make sure that it is flat. There's no distension. Okay. I'm going to be listening to all 4 quadrants of the abdomen, starting at the right lower. What I'm going to be listening to is for 1 full minute, listening for bowel sounds, and if there's any abnormalities for 5 minutes. Okay, starting at the right lower, moving to the right upper, to the left upper, left lower. Bowel sounds are present and normal active. Now I'm going to be moving and I'm going to be percussing the abdomen. Abdomen is dull and timpani. There is no sound of peristaltic waves, and there's no sound. There's no pulsations in the abdomen. Now I will be lightly pulsing. I'll be lightly palpating the abdomen. Please let me know if there's any pain or discomfort. Right lower, right upper, left lower. Any pain?
No, ma'am.
Patient is negative for any signs of guarding or rebound. Now I'm going to be moving on to the genital portion of the exam. General good color, normal appearance, no drainage, no tubes present, no catheter. Now I'll be palpating the femoral and inguinal area to checking for your femoral pulse. Is mid-inguinal, both are there, 3+ bilaterally. Now I'll be checking the peripheral pulses, behind the popliteal one at a time. Popliteal are both 3+ bilaterally, moving down to the dorsalis pedis one at a time again. 3+ bilaterally, posterior tibialis, 3+. Now I'm going to be starting your lower extremities exam. I want you to go ahead and push the gas pedal. I want you to flex your foot against me. Okay, go ahead and take your legs and turn around, please. Now just sit up straight for me. Legs are dry, warm, normal color for the patient. Bilaterally, I would like you to please stand with me. Okay, now with your right leg, I'd like you to go ahead and flex your hip. Okay, go ahead and put it back down. Let's do the left hip, flex it. Go ahead and put it back down. Flex your knee for me. Flex the other. Okay, go ahead and extend your ankle. Extend the other ankle, please. Now I want you to flex it. Perfect. Flex it. Okay, now what I would like you to do is abduct your leg away from your body, the other leg. You're abducting it. Now I would like you to invert your foot. Invert your foot. Evert your foot. Now invert it. Now I would like you to internally rotate it. Externally rotate it. Internally rotate it again. Now externally rotate it. Okay. Strength and range of motion is 4 out of 4 for the patient. Now what I would like you to do, I would like you to go ahead and ambulate. Okay, go ahead and turn. Gait is steady, no use of ambulatory devices. Now the last portion of the head to toe, I'm going to be doing the Romberg exam by standing behind you for 20 seconds, arms at the side, eyes closed please. Okay, the patient is stable on his feet, no swing. Go ahead and sit back down. This completes the head to toe exam. I will go ahead and begin my documentation. Everything that we did during the exam, I was able to speak with the patient correctly and adequately.